Hello, everyone, and welcome, and thank you for tuning into Health Leaders, the place for peer-sourced and solution-focused insights for healthcare executives. My name is G. Hatfield, and I'm the CNO editor for Health Leaders. Today, we are speaking with Andy McWilliams, who is the VP of AI Clinical Product Development and co-chair of AI Governance at Advocate Health, about a new AI telephone agent helping with chronic condition care management. So hi, Andy, how are you?
I'm great. Thanks, G. Glad to
Of
be here.
course. Yeah, thanks for joining us. And this is a great conversation as AI kind of takes the healthcare industry by storm here. So to kind of set some context for this conversation, I wanted to ask you, with ongoing workforce shortages, how do you see AI-enabled outreach tools reshaping workforce strategy and staffing models over the next few years?
Yeah, that's a great question to kick things off, and one that we're spending a lot of time thinking through how that really drives our strategy. And one of the things that we lead with, and whenever we're talking about AI strategy, is that our approach to AI is really first and foremost on being responsible. You spoke about the deluge of AI in healthcare. And we really want to take an intentional, responsible approach to implementing AI. And as we think about that from a workforce strategy standpoint, generally, as you know, across the board, we have a number of shortages across many different disciplines. We really think of AI, when implemented appropriately and responsibly, as a force multiplier for our teams. And I think what we'll talk about today really provides that example, real life example of where AI, when thoughtfully woven into workflows, can really offload some of the busy work, some of the more routine work, so that our teammates, as we call them at Advocate Health, can really focus on more complex issues and really focus on more time with the patients themselves.
Mm-hmm. Absolutely. So tell me about this new AI pilot. It's for hypertension, right? How does it work?
Yeah, so at the end of last year, we worked with a partner called Hippocratic to implement conversational AI as a way for reaching out to our patients with hypertension care gaps, as we call them. And what that really means is that patients have been cared for in our system, and in a primary care setting, had their blood pressure taken, and it was elevated, but then for a variety of reasons didn't come back in for follow-up. And with elevated blood pressure, very common condition. It's one of those conditions where we have very good evidence-based treatment guidelines, but across the board in the United States, it remains a very untreated hypertension, or hypertension that's not at goal, remains a very prevalent condition. And when we don't have hypertension at goal, translates to a considerable morbidity and mortality as it relates to cardiovascular disease. And so for us, this was a kind of an obvious first target for how we would collaborate with Hippocratic with conversational AI, because we know what we need to do. And as I said, a variety of reasons, but one of the main reasons that we can't reach out to every patient is we simply don't have the resources to be able to reach out in healthcare to everyone who has a care gap. And so in this case, it really exemplified our ability to be that force multiplier for our teams. And so we worked with our nursing leaders, our nursing teams, in order to build an agent that met our criteria internally. We were leveraging our knowledge base, leveraging our escalation protocols to really vet that agent, make sure that it passed our criteria for safety and patient experience. And then at the end of the year, reached out to around 15,000 of those patients with what we would call a hypertension care gap, in order to engage with them. And in that engagement, be able to, one, explain to them why this was important for them to focus on their blood pressure. Two, if they had the ability to walk them through how to properly check their blood pressure at home and provide that blood pressure reading back to our care teams. And if they didn't, provide them with the resources for where they might be able to get a blood pressure checked in their community, and then be able to follow back up with them or have them call back in with that blood pressure. And so in the midst of that, when I mentioned the building of the escalation protocols, as you have a conversation with a patient, oftentimes things will come up where we need to escalate that conversation or that issue to our teams. And that was part of what we baked in and tested in this process, was to make sure that as we uncovered issues, we were able to get them to the right teammate at the right time so that that issue could be addressed. So in essence, that was our pilot. And we can get to that in further conversations, but we really did this on a relatively small scale when we think of the breadth of hypertension patients to learn what we would look like in 2026 as we bake this in to standard of care, and with our kind of overarching goal to make this idea of end of year gap closure obsolete, but actually pivot with the assistance of AI to being able to be far more proactive and timely in terms of that follow-up if you leave a clinic with high blood pressure.
Absolutely. Yeah, that's fascinating. And we're going to get to the escalation protocols in a moment. But I wanted to ask, what role did nursing and nursing informatics play in designing and implementing and optimizing the program?
Yeah, so whenever we're building and implementing an AI solution in the clinical context, we really think of the end users as being at the table for development, so that the ultimate solution is really built so that it's useful as a force multiplier. It very much interweaves into the workflows of those end users, and so this example, like others in our system, is really built with those nurses at the table being the ones leading the charge. And as we pivot into taking this from a pilot to scaling through the organization, we very much lean on our nursing informatics team to really help in that design build and thinking through the workflow implications and training that we need. Because really important in any AI implementation is that last mile of implementation and making sure that it truly fits into the workflows and is a helpful aid and actually becomes that force multiplier and isn't a barrier that sits in the workflow or creates friction in the workflow.
Absolutely. And nurses are great because they'll tell you if that happens. So absolutely. So how were those escalation protocols developed, and how do they determine when the AI agent should hand off a patient interaction to a nurse?
Yeah, so beneath the conversational layer of the AI agent, we have very clear deterministic protocols that tell the agent when it needs to hand off. And some of those handoffs are actually a live handoff to our nursing teams. So when you think about the different layers of escalation, some things need to be addressed immediately, whereas some things could be addressed a few hours later or even the next day. And so again, in collaboration with our nursing teams and other operational clinical leaders, we went through in partnership with Hippocratic and made very sure that we had those different criteria within those different buckets framed up such that really when a patient had any issue that needed an immediate escalation, we had somebody on the other end of the phone that could get that warm handoff and deal with that issue. And to kind of circle back to your kind of earlier questions around our approach to responsible AI, that really becomes an important aspect of our testing strategy on the front end of rolling out this or other solutions in the clinical space. Something I think of as a crawl, walk, sprint sort of a strategy that we have, which is we really want to make sure if we have an AI agent in a clinical workflow that those critical components are one, caught, and two, those handoffs, those integrations work. And so on the front end, we do a whole lot of user acceptance testing that includes testing those endpoints to make sure they work. And new for the workflows of AI enabling this outreach, we needed to know what the volumes would look like for the nurses on the other end. What does that workflow impact look like? So that we could appropriately staff and make sure and meter the calls that were going out so that we would always make sure that nurse was on the other end to pick up the call that was going to be there. And so we started very methodically in the beginning and grew the numbers as we knew what those escalation rates might be.
Absolutely. And you mentioned responsible AI. There's obviously been a lot of kind of skepticism amongst nurses recently about kind of AI and like patient safety and data privacy and all that stuff. So how did your team kind of address those concerns around patient trust and consent and communication transparency when introducing this program?
Yeah, so a couple of things there. As part of our tenets for responsible AI at Advocate Health, transparency is one of those core tenets. And for us, and this was demonstrated in this project, that means making sure that a person understands that they're interacting with AI. And no place is that more clearly needed than when you're having a conversation with an AI agent. And so we work very closely with our marketing and consumer experience teams to ensure that the scripting with the AI agent meets our internal criteria and involves an introduction to the fact when the person answers the phone that they're interacting with an AI or virtual assistant calling on the behalf of their care team. And they also then always have the ability to opt out of that. And as part of that escalation pathway, if someone chose not to speak to an AI agent, that our teams would reach out to them so that they were still getting that outreach, but via one of our teammates.
Mm-hmm. Absolutely. Yeah, that was what I was going to ask is there an alternative? Because I imagine some people hear that it's AI and they're like, I'm not doing that.
Yeah.
I don't know how
And
much of a
we've done
percentage
some,
that is, but
it's actually surprisingly smaller percentage than we thought as well. But we've kind of pivoting back to our approach with responsible AI and this idea of transparency. We've done a great deal of work engaging with our patients and other stakeholders across the health system to really understand, what it means to them for us to be transparent and accountable as we approach AI responsibly, and thinking through how we, do more than just introduce via an agent that they're speaking with AI, but also provide additional content for folks and education more broadly on our approach. So in addition to publishing our approach in the peer-reviewed literature, we're working with our teams to also provide that deeper dive for patients if they're interested in learning more about how we are using AI at Advocate Health and healthcare, and perhaps more importantly, how we're doing that responsibly.
Mm-hmm. Absolutely. So do you have any outcomes from the program so far that you'd like to share?
Yeah, so our initial pilot, this pilot that we're talking about today, was meant to inform our decision as we move forward to make this part of standard care and proactively reaching out to our patients across the enterprise. And so we really set out to understand, how successful we would be at engaging our patients. So thinking of when we deploy AI, and an example like this, we're really focused on did it improve access? Was it a good experience for the patients? And was it a good experience for our teammates? And so when we looked at this access question, we were able to close care gaps for around 1,200 patients, and connected with a larger number than that, and we're able to get those folks who we weren't able to get a blood pressure from on that call, or their blood pressure remained elevated, to be able to plug another 400 into care with our existing kind of centralized nursing teams that either help them with their elevated blood pressure and helping to treat them to goal, or being able to resolve other issues that might come up, as you can imagine, in more of a free-flowing conversation. To us, that was very powerful because that spoke to the access, the improved access that comes from that force multiplier as our teammates were able to address those more complex issues, where AI was offloading the more routine tasks. So kind of circling back to that example from the beginning. And in this example, because it was end of the year, these patients wouldn't have had that access point. So it was a net new access point for those patients, and it was able to address hypertension, but also uncover some of those other issues. From a experience standpoint for our patients, we were actually surprised, and because it was unknown going in, what their evaluation of this experience would be. And so for those that filled out the surveys, it was over 9 out of 10 in their experience with the AI agent. We did some additional follow-up interviews and got very good feedback from our patients in terms of their interaction with the agent, the ability to ask questions and not feel like they were taking up one of our teammates' times, because they could kind of ask unlimited questions, and feeling that the experience was one that was very positive and helped them feel that they had a sense of agency around controlling their blood pressure. Our experience from our teammates, from the nurses that were part of the project, was also quite positive. So we felt like it really informed for us the outcomes that we were looking for, that we would then move forward with the work to scale across the system.
Absolutely. I know those are great outcomes for sure. And I'm so glad that it's increasing access to, because as we know, that's super important right now, especially as healthcare becomes more and more inaccessible every day. So that's great. So beyond hypertension, what other chronic conditions or care management workflows do you see being suitable for something like this with AI augmented outreach?
Yeah, so we're currently exploring that question internally and doing some work to address other chronic conditions. I think the answer really lies in those conditions where proactive outreach and education are related to improving outcomes. And so, we kind of went over that with hypertension, where we know what to do. We have the evidence to guide us, and it's for a variety of reasons. It's really trying to leverage resources so we can be more proactive and manage patients between their clinic visits. And so, I think that's true for heart failure, for diabetes, and probably true for COPD as well. So those chronic conditions that are highly prevalent, where we have fairly good data to show that being on the right medications and having those access points between your clinic visits improve your outcomes. And so at least for now, that's where we're starting, and trying to replicate the work that we've done in hypertension for those other chronic diseases. But I think it also, it raises the issue that it's, not every use case is going to be appropriate to leverage AI in the way that we've done. And so, being very disciplined in selecting the right use cases, and then following that very methodical, intentional approach to make sure that we wire things up appropriately and we have the right escalation measures in place, we have the right workflows on the back end, and really get to that point where, as we saw with hypertension, we get to that force multiplier and improve access and experience.
Absolutely. Well, I'm looking forward to seeing how this pans out at Advocate. Y'all do such great work on the technology front. So thank you so much for your time. I'm really grateful to have had this opportunity to get to know you a little bit and hear your insights. And thank you so much to our audience for listening. Thanks, Andy.
Thanks, G. Really appreciate your time and the interview.